Today, for the first time in India, Global Hospitals, Hyderabad, Lakhrikapul, we have inaugurated the first multidisciplinary IBD team across the India. So basically, the management of IBD, inflammatory bowel disease, which comprises ulcerative colitis and Crohn's disease, involves inputs from many specialists, be medical gastroenterologist, surgical gastroenterologist, a pathologist, radiologist, a dietitian, a IBD nurse, and a molecular biologist. So all these specialists coming under one umbrella will deliver this service on a dedicated day, dedicated afternoon in a special IBD clinic. So by doing this, and also by creating, we inaugurated a patient diary today. By following the IBD pathway and keeping all the patient's details into one diary will prevent or will improve the patient care in various ways. Like for example, this IBD diary will comprise many international guidelines where any specialist who is seeing this patient, among these multi-specialists we talked about, can follow these guidelines and look at these complications, implement these changes, and that's how we can improve the care of the patients. The IBD is very important to realize that IBS is completely different from inflammatory bowel disease, which is IBD. So the IBD is usually seen more often in younger age group, but nowadays we are also seeing in the later age group as well. And the main symptom, the commonest symptoms for the disease are bloody diarrhea or normal diarrhea, abdominal pain, weight loss, and lots of other complications. In fact, the patient can present with one of the extra-intestinal manifestations such as low back pain, skin rashes, skin lesions, eye symptoms, anemia, unexplained anemia. So all this can be a presenting feature of inflammatory bowel disease. So anybody who is suffering from unexplained anemia, unexplained diarrhea, unexplained bloody diarrhea should be evaluated thoroughly to see whether they got inflammatory bowel disease or not. Global Hospital being a tertiary referral center, we see the inflammatory bowel disease quite often. It may not be, the percentage may not be the same in outside general practice, but in our gastroenterology practice here, at least 10% to 15% of our patients are suffering from inflammatory bowel disease. So if the body doesn't produce appropriate immune response, in fact, if it produces inappropriate response, like more or less response, then there's a good chance the patient can get mucosal damage, can lead to inflammatory bowel disease. And lots of other postulations are also being proposed, like the industrial revolution and the food habit changes. We're eating more refined food nowadays, and also the migration across the continent is all been postulated in the increasing incidence of this inflammatory bowel disease.